Good afternoon. Thank you for joining us and welcome. My name's Kylie Walker and I'm the Chief Executive Officer of the Australian Academy of Technology and Engineering, or ATSE. In the spirit of reconciliation, I of course will begin by acknowledging the traditional custodians of country throughout Australia and their connections to land, sea and community. We pay our respect to their elders past, present and emerging, and we extend that respect to all Aboriginal and Torres Strait Islander peoples who are joining us today. And as we share our own knowledge, I acknowledge the deep and enduring knowledge embedded forever in custodianship of country. We're joined today by fellows of the Academy, as well as friends, collaborators and partners from across Australia and internationally. Welcome to you all. ATSE is a learned academy of independent experts, and we help Australians understand and use technology to solve complex problems. Our fellows are Australia's leaders in applied science, technology and engineering, and we bring them together to provide impartial, practical and evidence-based advice on how to achieve sustainable solutions and advance prosperity. So today, I'm very pleased to be able to get together for the Academy of Technology and Engineering's first international webinar. Thank you for joining us. We're talking today, of course, about our major new report. It sets out a vision for a modern, technologically connected and inclusive healthcare system. It's called A New Prescription, Preparing for a Healthcare Transformation. The report was launched in April this year at a time when the COVID-19 pandemic was gaining momentum globally and exposing the weaknesses and pressure points of health systems around the world. The pandemic's had been a stark demonstration of a number of the findings in this report, and it's provided urgent new context for its recommendations. Now that we're settling into new routines, we'd like to see the report's findings leveraged into action to support a transformation in Australia's healthcare system. This report is part of a major 3-year research project supported by the Australian Research Council, in which we're identifying key policy levers to support adopting technology in Australia, and we're developing a roadmap to guide Australia's technology research. So the first report in this series examined the transport sector. This second one obviously looks at healthcare, and the third will address waste and the resource recovery sector, and that's launching later this year. An expert working group was convened to produce this report, and you'll meet them soon during the Q&A session. We'll also hear a brief summary of the findings from one of the co-chairs of the expert working group. And you'll have the opportunity to ask our experts whatever you wish via the Q&A window at the bottom of your screen in this webinar. I'll moderate that discussion and ensure as many questions as possible are answered. But first, I'd like to introduce one of the co-chairs of the steering group that's overseeing the report series. Catherine Fagg is a leader of industry with board positions on a range of major companies and not-for-profits. She's a former chair of ATSE's Industry and Innovation Forum, and I ask you to welcome her now. Catherine.
Thank you, Kylie, and welcome to everyone online today. As Kylie mentioned, the report, A New Prescription, Preparing for a Healthcare Transformation, is part of a major 3-year research project funded by the Australian Research Council. In this report, we examined the technology readiness of Australia's health sectors, with a view to informing policy decisions to help prepare our industries and our communities for the oncoming wave of technological disruption. This examination of the healthcare sector had 4 objectives. Firstly, to identify existing and emerging technologies that will affect the healthcare sector over the coming decade to 2030, and to determine which have the potential to deliver the greatest benefit. Secondly, to examine the readiness of the healthcare sector to adopt, adapt, or develop these technologies to address key challenges in the decade ahead, through research and targeted consultations with representatives from government, the healthcare industry, and research. To provide advice and recommendations to policymakers, the healthcare sector, and the healthcare industry on using technology to support the healthcare system to transition its focus to prevention and to wellness. And fourthly, to highlight future research priorities to support the healthcare sector in its transition to focus on prevention and wellness in the decade to 2030 and into the future beyond. This report fulfills all 4 of these objectives by pulling together research, industry insights, lived experience, and policy perspectives into a sophisticated review of technology in our health system today and where we could be in the future. COVID-19 has starkly shown areas where Australia can improve, not just in healthcare, but of course also manufacturing, information technology, and technology underpinning industry in general. While the work on the report was largely completed prior to COVID-19, one of our key recommendations to broaden access to telehealth has already been partially implemented by the government in its response to the crisis. The fact our recommendations are already being preempted in the response clearly shows these are the right technologies to support our healthcare system and workforce, not just in the fight against COVID-19, but also into the future. I now have the pleasure of introducing you to Sue McLeeman, who, along with Simon Foote, led this group, the expert working group, who pulled this report together. Let me tell you a little about Sue. Sue McLeeman has been CEO or a senior executive of multiple Australian listed companies in the medtech and pharmaceutical industry. She now leads the Australian Industry Innovation Growth Centre for this industry sector, MTP Connect. Sue is responsible for developing policies and programs to grow this important industry sector, and she serves on many key committees, such as the Department of Defence Medical Countermeasures, BESCI, and the CSIRO Health and Biosecurity Division. Sue brings industry and policy experience, as well as a focus on innovation in the biotechnology and medical field. Welcome, Sue.
Thank you, Catherine, and a warm welcome to our friends and fellows. And please don't hesitate to start typing in your questions to the expert working group as I work through some of the key recommendations from the report. As many of you know, we're incredibly fortunate to have one of the best healthcare systems in the world, but it has been under strain for some time. Our ageing population, the rising levels of chronic illness come at an increased demand for health and medical interventions and have been adding to the burden of the system. It's not just the current pandemic that's putting a strain on the system that largely is focused on treatment rather than prevention, that still relies on face-to-face consultations and long waits in GP clinics or emergency rooms. Although, of course, as mentioned, we've recently seen telemedicine open up during the pandemic. And many of these clinics and emergency rooms also still use outdated technology to capture data and communicate data. As technology evolves and improves, so should the way in which we deliver healthcare. We need a new prescription, a focus on prevention and wellness as well as treatment, and this should be enabled by technology. We have used what we've learned to develop a vision of a technology-enabled future healthcare system that is efficient, focused on good outcomes, and empowers patients and our healthcare workers. ATSE's report, A New Prescription, outlines how we can take best advantage of existing and emerging technologies to further kickstart that shift and that nudge to a digital future. In A New Prescription, some of the ways we predict technology will do this include the disappearance of paper files, replaced by secure electronic health records. Health professionals will share patient information through universally accessible systems that ensure data integrity and security. Smart devices, mobile health and telehealth, all linked through a digital health record, will enable a real-time, holistic picture of a person's health and a better dashboard for healthcare professionals to manage that patient care. Technological solutions to the problems of distance and mobility will enable affordable healthcare access for more Australians when and where we need it. Big data will enable accurate monitoring and prediction of population health trends, and genetic testing and screening for preventable diseases will become more affordable. Governments and industry are already working on these complex and sensitive issues, and through targeted action can maximise health outcomes and economic opportunities for Australia, and of course support our healthcare workforce into the future. ATSE assessed Australia's readiness to adapt, adopt or develop technological solutions according to 5 key parameters. How ready was our infrastructure? Did we have the right skills and expertise? What about the ELSI issues? Are we socially and ethically and legally ready for some of these new technologies? Economics and commercial feasibility, and also the policy and regulatory readiness and frameworks. We spoke to over 200 organisations and individuals in healthcare, industry, research and government, and overall they said the good work is already being done, but there are 4 key areas that need further attention. Healthcare must be digitalised. We need to change that focus to include a focus on prevention and wellness. The workforce needs support to skill up, particularly in digital literacy and how they might be able to utilise these new technologies. We need to make sure that access to healthcare is improved across Australia. In order to address these issues and for Australia to be ready for the opportunities presented by each technological solution, ATSE has developed a set of robust, forward-thinking and achievable recommendations for stakeholders in government, industry and research. The collection of high-quality structured health data is a priority for Australia's healthcare sector over the next decade, as digital technologies become increasingly interconnected and communicative. All healthcare providers must switch to electronic records to make this possible. It's ATSE's vision of health in 2030 that there be no more paper files, but universal, secure, electronic and trusted health records. Health professionals will be able to easily share patient information with appropriate data protection, improving care and outcomes. Analysis of big data will enable accurate monitoring and prediction of population health trends, informing and enabling governments and others to act early and invest in large-scale preventative or control measures for emerging lifestyle and infectious diseases. To support this shift, the Academy recommends the Australian Government should develop interoperability standards for digital health, including data collection, sharing and security standards. Social acceptance for electronic health records will fundamentally depend on well-communicated privacy and cybersecurity frameworks. And to build social licence, the Australian Government should develop a national framework to strengthen health data privacy and usage, building on the experience managing health privacy under the Privacy Act and in response to the Productivities Commission inquiry into data availability and use. There are still questions about the best way to integrate new and existing digital technologies within different healthcare settings, and we will need the help of our research community to join up the health ecosystem as we move through this digital switch. The use of telehealth and AI-enabled devices must increase to support equitable outcomes for people living with disadvantage and to improve access and reduce financial burden. In a tech-enabled future, we'll be able to connect the information gathered through phones and micro-wearables and other wearable devices and sensors to provide a real-time and holistic picture of an individual's health. Commonplace use of remote consultation will also open up better advice and treatment options for people who live remotely or who are unable to leave their homes safely or have limited access to medical specialties. The national healthcare workforce must be supported and empowered to retrain, adapt and develop skills to use new digital technologies. Empowering the workforce to maximise the benefits of new healthcare data and communications technologies will free up their time from administrative tasks, better support their medical decision making and result in improved health outcomes for patients and wellbeing for healthcare workers. All levels of government should take action on the National Digital Health Workforce and Education Roadmap to assist the healthcare workforce to adapt to a technology-driven workplace. Qualifications and training must be agile and ongoing, supporting the healthcare workforce to adapt to changing technology roles and tasks. Despite a very successful medical and life sciences research sector here in Australia, we do still struggle to get our world-class medical research fully translated and commercialised for use in everyday healthcare. Government support for medical research is generous, but this support needs to be better targeted to and aligned with translation and pre-commercialisation activities. Government must support investment in improving pathways to commercialisation for Australian developed medical technology and create an environment in Australia where our health technology startups are attractive to investment. Such an environment can be achieved through strategic and targeted support for health technology researchers and startups in areas with high growth potential. Australians' grown technology can support our healthcare system as part of the same ecosystem, with products and services designed for our particular circumstances, but also unlock opportunities that we can then take to the world. Government procurement clearly has a role to play. So where to from here? The good news is the gap between the current operation of the health system and its technology-enabled potential creates an enormous opportunity for strong and swift improvement. Closing this gap will set Australia up to not only deal with our future pandemics, but also deeply enhance our capacity to respond to our business as usual healthcare needs. The COVID-19 pandemic has seen an unprecedented global health, economic and human crisis. All over the world, countries are shutting down and working to keep their health systems from being overwhelmed. The timing of the report launched in April was uncanny and led to many conversations about what might have been different had these recommendations already been implemented before this crisis. What could have we done to ensure our health and economic systems were more resilient to a catastrophe of this magnitude? And how might Australia prepare to manage for the next global threat or pandemic? What sovereign capability do we need to build, and what supply chain resilience should be in place? While the pandemic has already accelerated some of these changes beyond what we could have imagined, the rapid expansion of telehealth, for example, implementation of these reforms could have seen a better response to the pandemic in a number of ways. In a fully digitalised healthcare system, government and the medical community would have been able to identify and monitor COVID-19 in real time, using machine learning to identify disease outbreaks by looking for spikes in the reporting of relevant symptoms, and using other relevant information to build the case for outbreaks. Additionally, if we'd already been geared up with an agile manufacturing and supply chain resilience, Australia would have been better placed to support the response, with enough critical diagnostic, medical and pharmaceutical solutions where and when they were needed. We've done okay though, and we should be very proud, I think, of the way that Australia has responded to this pandemic, but there is always more work to do. Work has already begun in all of these critical areas, and the COVID-19 pandemic is fast-tracking our response to others. But to be truly ready, resilient and responsive, we need to do more and make faster progress. We must learn the lessons this pandemic and our responses to it have to teach us. Make data and digitalisation in healthcare a priority. Keep the expanded access to telemedicine and build on it to support equity in our healthcare system. Support our healthcare workforce to be the best they can be, and support investment in improving pathways to commercialisation for Australian developed medical technology, for our health, for our economy, and for the sustainability of both. With a new prescription for the healthcare transformation, we can and we will create the health system of the future. I thank you for your time today, and I'm looking forward to seeing questions that were generated by you. And on that note, I hand back over to Kylie Walker, ATSE CEO. And might I add that Kylie has only stepped into this important role in January this year, but is doing a terrific job. So thank you again.
Oh, thank you very much, Sue, for those kind words and for your presentation. Now, attendees, you have the opportunity to ask your specific questions, and I can see that we've already got a couple of questions coming in. Please use the Q&A text box at the bottom of your screen to ask your questions, and we'll cover as many as we can. But before the first questions, I'll briefly introduce the rest of your expert panel for today. Sue McLeeman is, of course, one of our discussion panellists. The others are Simon Foote, who was the co-chair and who produced the first physical map of a human chromosome and the entire human genome. As well as being an expert in the role of genes in disease, he has a strong record of commercialising biotechnology. Greg Teggett is a leading advocate for smart assistive technologies that give aged and disabled people independence and improved quality of life. He's also a policy and industry leader and a leading thinker on technology and the future of society. Greg Morstan is the Deputy Chair of ATSE's Health Forum. He's had a major impact on the pharmaceutical industry through discovery and commercial application of treatments for major diseases, particularly those involving bone marrow transplants. George is also an executive and a director in a range of medical research and product development organisations. Alan Trounson is the scientific force behind the development of IVF, and he's also a leading founder of the National Stem Cell Centre, amongst others. And Carrie Hilliard, who is a member of ATSE's board, but she's here as a chair of 3 biotech companies who's served on government, public and private boards in the life sciences. So please make all of our panellists welcome. The first question that we have, I think, might go to Greg. So the first question is, the major challenge facing healthcare is the ageing population and the normal physiological changes faced by an ageing body. How do we better integrate healthcare with the support systems required in ageing and ensure high quality yet economically sustainable system? Thank you, Greg.
Thank you very much, Kylie. That's a very interesting question that people have been grappling with for quite some time. And it's becoming particularly acute in Australia as the percentage of the aged increases. I don't have a simple answer. If I had, I'd have made a lot of money out of it. But it seems that we do need to pay more attention to engaging with the aged population and trying to get them to understand the potential of new technologies. And that's what I've been interested in doing for the last few years. And it's changing quite rapidly. And I think particularly we see in the COVID situation, the rise of telehealth. And that has a tremendous potential for the aged community, enabling them to get access to information and advice and rehabilitation advice, etc., without actually having to attend to centres and sit in waiting rooms, etc. And the ability for them to be monitored and that monitoring material fed to people who can deal with it is very important, I think. And I see that as a very important area for us to develop. Thank you.
Thanks very much, Greg. So our second question is about the value of integrating international technology. So if there are already good e-health technologies developed elsewhere, why wouldn't we integrate those rather than trying to reinvent the wheel? Carrie, I'm going to invite you to step forward and answer this question.
Well, yes, it's a good question. I think the important thing is that we embed all of the right technologies that will suit Australia. Some technologies don't, but generally they will. And I think it's important that we accept that there are inventions everywhere. Sorry, is there a problem? I think, you know, overall we need to bring in the right technologies.
Thank you very much, Carrie. And I do believe that we recommend in this report, as well as in other publications of ATSE, that we do maintain a monitoring and a connection to the international technologies as they're developed. Obviously, we want the best available rather than necessarily focusing only on domestic, but we also want to develop and integrate our own capacity and invest in building our own capacity to develop new technologies and apply them. So our next question is around our Australia's historic slowness in implementing well-tested health technologies and the fundamentals of investing in telehealth services, particularly for rural and remote communities. And I'm wondering actually whether Carrie you'd step up and answer this one as well, looking at bringing the existing technologies out to rural and remote.
Yeah, that's hugely important, and certainly something that we've been trying to do at the at the Leukemia Foundation, where we really feel that it's important that you get access to the right healthcare, the right diagnostics when you need them. And telehealth is just going to make such a difference to that. It's already making a difference. So.
Okay, thank you very much. The next question's about privacy concerns relating to digital health records and cyber risk. Sue, would you be able to step up and take the question from Marlena Kanga about the privacy concerns, please?
Yeah, look, I think everyone is aware that as we integrate new technologies into healthcare, that we do need to navigate all of those issues of social acceptance, the ethics, the legal, and of course, data security and integrity. And I think there's a huge amount of work already that is being done in this space, and we've seen the work being undertaken by the Australian Digital Health Agency and their recommendations, and also the recommendations from the Productivity Commission. So I think we're well advanced in that. I think Australians are natural skeptics when it comes to some of these new technologies and how their data is going to be used. But more and more, and we have seen it through the uptake of the COVID-19 app, we've actually seen that Australians can see the value. And so I think we need to be able to communicate that value proposition more clearly. And I think we have to be able to articulate in more detail how we intend to keep that data in high levels of data integrity and security in order to get buy-in from the broader population. So it's a two-edged sword. You've got to explain what the value proposition is and why that data will lead to better healthcare outcomes, but also put in place the right systems and frameworks and processes to ensure that we have robust, safe systems for use.
Thank you very much, Sue. And I guess pulling back out to the bigger picture while we've got you on screen, there is a question here from Dato B about quantitative funding recommendations, and we have steered away from including quantitative funding recommendations in the report. I guess that's a next step in terms of implementation. Sue?
Look, I think there's a huge amount of thinking now by lots of different groups right around Australia about resetting some of what we do right across the board, and what those opportunities for a technical bounce might be, what are those new economies, what are those new industries, what are those new population opportunities. And I think that is the right reflection that we should take, and we are doing that. And I expect there is an opportunity to rethink some of what we've been doing and perhaps make some more directed funding in key areas where we actually think we can have good interventions and help Australia, but also the rest of the world.
Thanks, Sue. Not unrelated to that, a question from Erica. Thank you, Erica. It's been 4 years since the Fraser-Finkel-Ferris RDTI review, and legislation is once again being reintroduced. So given the experience of COVID-19, should there be a pause to reconsider how to best progress these reforms to maximise our health and medical manufacturing base and the application of innovation in practice? George, are you able to step in and take this question, please?
Well, it's not necessarily my area of expertise, but I think the key issue is that we're now learning that we have to be more self-sufficient in certain areas. We need to identify what it is we have to actually make in Australia. We've sort of somehow depleted most of our manufacturing capacity, and I think we are now going to have to relook at what resilience represents. Can you hear me? I also wanted to mention, while I had a moment, that the key to acceptance of digital health, which is how I got involved in this, is patients have to see what's in it for them. And I recently had an experience of being treated at the Mayo Clinic, where they have a patient portal, and as soon as a test is done or an opinion is provided, the patient receives it if they're on their iPad or whatever. There's no secrecy, and it's perceived that the data belongs to the patient. And I think if we can move towards a situation where people have their own data, which they can see, monitor, they're going to be much more willing to go into this. And when I was at the VCCC, trying to create a patient portal was a tremendous part of what we were having difficulty in getting funded. I thought would be very critical in having this technology accepted.
Okay, thank you. Thank you very much. A question via the chat function, and I will ask you to please, if you can, direct your questions through the Q&A box at the bottom of your screen. It's next to the chat box. It enables us to have just one box open while we're trying to manage the various bits of information coming in. Thank you. But we will go to this question from Rick. What policy levers should be used to promote the uptake of digital health technologies? There's a well-known lag with take-up of all health technologies. So do we need more financial and regulatory incentives to drive the uptake? Sue, please.
Look, I think we do need some specific directives to digital health, and I'm talking there in the broadest definition of digital health, and I guess using the FDA definition, which would include things like supporting not only telehealth and use of patient data, but more broadly sensors and micro wearables and the data that may provide us. I expect that we need to almost see digital health as another area on top of biotech, pharma, and medical technology as almost a standalone industry that we have an opportunity to grow. One of the good things about digital health initiatives is that we can scale those, and often the amount of money required to develop those technologies and scale them is less than some of the other technology approaches. And so you have the opportunity for every dollar invested to actually have a more positive impact on more patients. So I think, yes, there does need to be some additional initiatives to drive some of these new industries, and clearly that takes the entire ecosystem, but government will have to play a role in that.
Thanks very much, Sue. I have a question for Simon now. How do we ensure the pace of developing and implementing much needed health technologies, e-records, genomic testing and big data are effectively aligned with the development of protective ethics and privacy laws?
Yeah, so this is very important. So it's a very good question. And if we don't get this right, then people will actually not use or not have faith in new technology. However, having said that, people have actually had quite a lot of faith in the fact that we already use a very large amount of electronic data. There's quite a lot of electronic data storage. Every time you get an X-ray, it's stored electronically. All your blood tests are all stored electronically. So already there is a huge depository of electronically stored data that is really well protected. There are already a large number of protocols in place to protect our privacy. Now, I'm not the one to suggest that we're exactly where we should be, but I think that to get from where we are at the moment to where we should be in terms of privacy is not such a big jump as one might imagine.
Thanks very much, Simon. I have a question for Carrie now. From Stuart, has the government given any indication whether they will support and action incentives for improved early stage commercialisation funding for Australian inventions in the healthcare space? We agree, Stuart, it is sorely needed.
There's a lot of discussions about this at the moment, and there are quite a few good programs like the Entrepreneurs Program that funds early stage companies. Of course, you have to have matching funding, so there's still some need to get some money from investors. There are still issues with very early stage funding. Some of that is because investors have got bigger and bigger funds, and therefore they have to invest larger chunks of money, and that's created a bit of a problem. And so we do still need some support at that early end. And so there's things like the IIFs were very focused on the early stage, and I think that that's something that would be valuable, but we haven't had any information about that at this point.
Thanks, Carrie. Sue, did you have anything to add there?
Well, I think that we have to show a return on investment, and I think that we've got a lot of amazing research. I mean, the NHMRC and ARC and all of the research that's coming out of our medical research institutes is very high calibre. But we need to be able to translate that, or at least a portion of that, into products and services. And that requires us to show that when investors come in and support those companies, that they do get a return on that investment, so that they're able to reinvest into the sector to drive that ecosystem. And so I think that we actually need to show some success, return on investment from that money deployed, so that we can actually get that reinvestment to drive new technology development.
Thanks very much, Sue. Alan, I'm going to throw the next one to you. This is a question from Marie. It's said that the NHMRC funding is generous in this country, but there has been no increase in the last 8 years. And so success rates have fallen markedly. And if we don't invest in fundamental research in the health sphere, there'll be nothing to commercialise. It's more of a statement than a question, Marie. I wholeheartedly agree. Fundamental research is absolutely crucial. Alan, do you have any comments to add to that? Sorry, Alan, it looks like you don't have your microphone on there. Would you mind just switching that on, please?
Sorry, yeah, I mean, it's a very important continuum of having basic research provide the discoveries that you can actually take off into the commercialization or into the medical clinics. And if you don't have a strong basic research, then you will have a drying up pipeline. So there is some very major concerns about the lack of incremental funding that's happening in NH and MRC and the way it's been handed out as well. There are a lot of concerns around it. And as the funding decreases, of course, it becomes more competitive and you know, changes the sector into wanting to do something else as well. But we've also got to have, you know, a strong commercialization rise from these discoveries. So not only NH and MRC, that has to be connected to the next stage, which is essentially the valley of death, because what Sue was talking about is too far down the trail. I mean, if you're going to you know, fund some of the commercialization projects that look like winners, that's where venture capital comes in and should play. It's the earlier stages which takes those discoveries where they're just really ideas or got some, you know, real notion that they could produce something especially important. They're the ones that are struggling, and you can't necessarily get it from the NH and MRC because the grants are generally too small. So keeping a healthy NH and MRC program and then being able to take it through the translational pathway up to commercialising, it's very, very important, and we're not doing that very well.
Thanks, Alan. Carrie, we've got a couple of questions now on the issue of preventative healthcare, and we know that prevention has been a goal in healthcare for a very, very long while now. In fact, as George points out, since Hippocrates. And you could argue that we've done a good job based on the improved longevity in Australia, although of course it's not universal, that improved longevity. So George would like to know how we need to respond to acute pathologies as well as building in that preventative healthcare. So do we have a two-tier system perhaps? And in addition, John has asked the question that given the emphasis in the report on preventative action and its ability to support a greater population health, what are the key issues for the integration of nature health interactions, such as smoke, malnutrition, mental health, for example, in the next few years? Carrie?
That's a lot to answer. As you know, I'm very keen proponent of prevention, but we do need to respond to acute problems as well. And largely the allied health area has been dealing more with prevention than the mainline health. And I think some of that is down to the incentives and the fact that our doctors aren't incentivized to provide wellness support. They're there to deal with acute diseases or acute problems. And that needs to change. That sort of reimbursement, that the incentives need to change in order to make that happen more broadly, I think. But so what was it? I'll find the other question. Sorry, Kylie, can you just...
So there was a question about the two-tiered approach potentially between preventative and acute, and the other one was about the targets for integrating those nature-based approaches to healthcare, preventative health.
So I mean, a lot of that's happening at the moment, but it is happening in the allied health space. So there are people doing genetic testing, not whole genome or anything really complicated, but really just to focus patients, clients on keeping well. and giving them some generalized and specialized information. And one of the things that certainly a lot of the allied health professionals have been finding is that they are getting better responses if they've got some kind of a genetic test, if it's precision, if it's precise, if it's personalized, because patients then stick to it better. There's good data on compliance, and it is about simple things like changing your lifestyle, changing smoking, doing more exercise, but it also directs you as to what sort of exercise is going to help you, and diet. So I think those things, we have to integrate all that, because we're not going to be able to afford to have that chronic disease keep going, because it is actually going to cripple our healthcare system if we're not careful.
Thank you, Carrie. And absolutely, of course, while some of the preventative and lifestyle measures are simple, for individuals they may be a little bit more complex to implement, and technology can certainly support people to do that. Thank you very much for tuning in, Margaret. It's excellent to see you here. And Margaret is asking a question for George. With the rapid expansion of telemedicine during our response to COVID, we've seen a greater acceptance by the public of this technology. So do you think that this will be translated into an increased acceptance and trust in digital health records? They've had a spotted past. Do they have a bright future?
Oh, I think absolutely. If we can show value to patients, as I said before, they will come and they'll continue to use it. I think there are some issues around reimbursement. Will it remain for telehealth? Can we in the acute medical area make it more sophisticated? Because I think telehealth at the moment is being widely used, but often it's a phone call. There are people who don't even have a phone. We have to have equity. But, you know, if we can, you know, there are interesting cases where, you know, a sort of patient shows up and casualty, everyone's scared to listen to their heart, and then a couple of weeks later it comes out that they've got sort of cardiac disease that wasn't heard but could have been with the appropriate telehealth devices. So I think now that we've tasted it, we can do it from home, we like it. There are obviously issues around keeping our medical workforce in the country as well as in the city, because people may have a tendency to bypass their local medical community and communicate with who they see as, you know, physicians in the city. But I think now that we've seen it, I think it's going to go and great heights, and it needs more investment, as the report suggests.
Thanks very much, George. This next question from John Mattick, thanks for joining us, John, is for Simon. So John, and thank you also for your kind words, thanking the policy team and the, of course, the working group for all of the work that they've done for the well-researched and presented report. Your thanks are very well received. So John's question is that the report mentions genetic tests, but it doesn't emphasise the acquisition of genomic data and its integration with clinical and pharmaceutical records, as well as smart sensor data and the infrastructure required to deliver the evidence-based analysis of the information, and then using that evidence to inform busy clinicians and other health professionals at the point of care. So how do you see this analytical infrastructure being developed? Simon.
So, John, thanks for the question. We've very carefully used the word precision medicine, and precision medicine, as you know, is an integration of genetics, genomics, of physiological data, of clinical data, of environmental data. And this is where precision medicine is going into the future. The genomic data will be just a part of a final diagnosis and pathway to therapy, or hopefully a pathway to the prevention of disease. So I understand what you're getting at here, but I think precision medicine includes everything from, you know, classic biochemical, radiological, etc. testing, genomics, and we'll be putting a layer of AI and data analysis. And as you said, one of the problems is getting all this information back to the clinicians. And again, that's a fairly major part of our report is how do we actually get all this complex information back into the clinic, and so that it gets acted upon appropriately.
Thanks, Simon. And I might actually throw this next supplementary question from John open to the panel. Feel free to jump in. And the supplementary question is this: what do you think the healthcare system of the future, say in 20 years' time, so the near future, what might or could it look like? I'll dob you in if you don't jump in. Okay, Sue, you're first.
I think Simon's responding to that, but he's muted.
Okay.
So I was just going to actually say one hope for 20 years' time for John here is that we actually have a vaccine to the new coronavirus.
If we haven't, Simon, then we've really failed very badly, because we've been warned about this for a long time, and we didn't take note of it, and we didn't fund the vaccine work well enough, and we really have to put together the kind of things that we're recommending here. So in 20 years' time, it depends if the whole community, including the government, responds to this, plus importantly, the medical profession, then medicine will be, I think, very different. I think patients will have a lot more say in their treatment, because I'll be better educated about what the options are. And I think it'll be a totally different exercise, and hopefully a much better process than it currently is. And in 20 years' time, I'd feel hopeful about that, but I don't think there's any guarantee unless the whole community, the profession and the government actually take up these recommendations immediately.
Thanks, Alan. Did George want to jump in there?
I just wanted to say we should congratulate ourselves that we actually in Australia have a health system, and I hope in 20 years' time it's still a system that involves everyone and care is available for everyone as things change. If we look at places where both the best and worst medicines available, like the United States, UK, I think we can congratulate ourselves that we've somehow been able to keep everyone in the boat. And I hope 20 years from now, that's still true as we deal, as the report predicted, with pandemics and other illnesses that affect, large parts of the population.
Did anyone else on the panel want to jump in on that one?
Can I add that I think that we will probably have genetic testing for most of our people, that they'll actually have that whole genome tested as they go through life. I hope that we'll have better access for everybody, so that there's an equal access across the country despite the distances.
Thank you very much. I also hope for a more inclusive system enabled by technology and the infrastructure that supports it. So we have a question from Branko for Sue. Branko wants to know what the relationship is between this report and the Australian Digital Health Agency. And I know that we did consult very closely with the agency in drafting this report. Sue?
Yeah, we did, and I'm very grateful for quite a large team that were involved from the Australian Digital Health Agency, who took the time to be quite thoughtful about the future of health in Australia and how they could support that. So yes, we definitely had a discussion with them, and we consulted that 5-year strategy and thought about how we could advocate, facilitate, coordinate and amplify some of the key messages that they were putting forward through there. So I think we're actually quite well aligned. I don't think it's happening fast enough, and I think that part of our push as we have conversations with all stakeholders in the coming months will be really to advocate for the digitalisation of health much faster than we're doing now, and also to be thinking about that digitalisation more broadly than just patient data.
Thank you very much, Sue. The next question, I think, for Carrie from one of our international visitors. Thank you for joining us from India, Devdatta. You'd like to know whether Australians generally focus on health and wellness. So, for example, do Australians have health insurance cover? And how do we suggest that there is an increased focus on wellness and health promotion before getting to medical care or responding to illness? Obviously, the situation in India is different from that in Australia. Thanks, Carrie.
Yes, it is. There's a large proportion of the Australian population that is interested in health and wellness, and they have apps and sensors and etc. that they use to monitor their health, monitor their exercise, their diets. There's a whole load of things that people will do. It's not general though. We still have a lot of chronic disease, a lot of very overweight people, and so we're not there yet. I don't think most Australians have health insurance, but the Medicare covers everybody anyway. So that will be a bit different to what we have what there is in India, I think. So we are very well covered by our health system. But there will be a lot of pressure with aging and with chronic disease if we don't do something about wellness. So I do think that we have to address that. And I would think that you need to do that in India also.
Thank you very much, Carrie. The next question is from an anonymous attendee, and the question I think might be for George. What would be the best strategy to implement proven effective e-health technology into health practice in Australia?
I think the importance is both to collect digital data in practices and then to have health exchanges that actually link the data so that the data is present wherever you are. Even though we've now got some initiatives in terms of electronic medical records, and they all obviously the companies come from overseas, it's not necessarily integrated. So we have a lot of reduplication. But to me, what's important, to me, what's important is that patients have to see the value, and that's why I mentioned the patient portal previously, and will again. I think that if we can give patients access to their information at the same time as their doctors, and they will then see the value of it, and it will go quickly. Obviously, the resources required are incredible. Mayo Clinic spent over $1 billion setting up its electronic medical record infrastructure, so we do need very stepped up investment, but also the technology is changing quickly. So there'd be more money and more motivation from patients to actually have it happen quickly.
Thank you, George. Sue, I'm going to throw to you for Valerie's question. What would be the best strategy to implement proven, effective e-health technology for primary stroke prevention into health practice in Australia?
I feel this should probably go to one of the clinicians on the panel, but I'll give it a go. I think firstly, building awareness of the tools, those e-health tools that might be available, making sure that they're properly funded and that we can properly evaluate them for safety and efficacy in the broader context of the larger landscape of stroke prevention and treatment. And then I think for those ones that are most promising, to really think about the implementation science of how we actually get those integrated, those new technologies integrated into medical use. But it requires a process, it requires the right fit for purpose regulation, and it requires the right reimbursement and path to market strategies.
Thank you, Sue. Greg, prick up your ears. This next couple is for you. Branko quite rightly points out that the ARC has not funded biomedical research with a health focus, and this stuff generally does fall between the gaps between the NHMRC and the ARC, although the Medical Research Future Fund does pick up some of it. Branko notes that this is killing that biomedical engineering research, and that ARC funding in the past was a key driver for this kind of innovation that is missing today. Stuart has agreed with that and suggests that we need to lobby for an agency in between ARC and NHMRC that specifically funds health engineering research. Greg, I'm assuming they don't mean the MRFF. I'll throw it over to you.
Yes, this has always been a problem between the NHMRC and ARC, and I do see the crossover there that is increasingly growing and probably does need, I think, some separate biomedical field, the grippingness between them. what intrigues me is how do we put things like 3D printing into this mix, and the way in which we're beginning to use biomaterials. And these are coming from other sectors which are not being really picked up particularly well by the present system. I don't have a clear answer, because we have another authority. Everybody will say, well, yes, that's got to do all the other things, and we'll still be struggling to find that boundary. I think we just have to really think again about where that linkage occurs now, because engineering, for example, is now becoming a major component into medical technology, and I don't have a clear answer. If I had, I would have been promoting it. But it's certainly an issue that we do see things falling down the cracks, I think. And even overseas, none of the areas there have really brought this together. I'm a materials person from my background, but I see now in the materials area, biomaterials and medical things coming together in a way that I would never have imagined in the past. And so I think we have to maybe sit down and do a little bit of foresighting about how we can see these areas coming together. And I've always been an advocate for the issue of converging technologies and what happens when you put nano, bio, info and cogno together. And we haven't got a system that enables that to be facilitated at the moment.
Thanks, Greg. And perhaps something for ATSE to think about as well. What is the most appropriate mechanism to support the development, the research and development of these multidisciplinary or interdisciplinary applications, or creation of knowledge and application of that knowledge for specific purposes and outcomes? Something like an X Prize, perhaps, which is big challenge focused.
Yeah, Kylie, can I just jump in here? Alan, I'll jump in for you, Alan. Look, I don't completely agree with this. I think that given the limitations of its funding, the ARC does fund a lot of biomedical engineering projects. And I think that there's those sort of projects are equally competitive with other physics and engineering projects that it actually funds. So I think that the problem is not that the ARC doesn't fund these, but because it does, it's just that the ARC funding envelope is so small. And the other agency in Australia that we actually have to look at, which does quite a lot in this area, is CSIRO. And I think that interactions between universities and CSIRO have actually led to some really fantastic advances.
Yeah, I agree with Simon, but I also seen the connection between stem cells and engineering and 3D production of organs and organogenesis and so forth, and that's all happening in the medical space as well. So I think it just needs better recognition, I think, of it, Greg, and I think the benefits for a number, a lot of different disciplines within medicine can benefit from not only engineering but other disciplines. So we need to have a porous capacity if we're going to continue to fund in the NH and MRC for medicine, that it should incorporate these matters, and I think the discoveries will really drive very strongly from where you have interdisciplinary connections in this space, and likely to sort of progress things very well. And I think that's happening, but we probably don't recognise it well enough in different parts of it.
Thanks, Alan. And so, did you have something to add here?
And I would call out the Medical Research Future Fund and some of the projects that are running there. Even at MTP Connect, we deploy some of that money on behalf of the Department of Health, and we actually have specific programs that do invest in biomedical, including engineering. And there have been many successful projects that have been supported through that have then gone on to get future investment from venture capital, and then more importantly being able to actually stand on their own 2 feet and commercialise projects and products. So I think there are other mechanisms of funding for some of those applications, and I think there is an understanding right across the sector that in fact a lot of the most interesting stuff is happening at the convergent areas, and that we're seeing a lot more cross-discipline teams as part of the solutions.
Thank you very much. And I will flag that we are coming towards the end of our Q&A session now. This next question I'm going to open up to all of the panel, and this is from Dato Lee. Thank you, Dato. Dato is a commissioner of the UN Broadband Commission for Sustainable Development, and he's lobbying operators who own 5G networks to go from merely carriers of digital knowledge to creators of digital knowledge for wealth creation, focusing on ASEAN and the Middle East that might be interested in investing in Australian telemedicine applications rather than in the traditional manner where Australian innovations go to the United States and Europe. So what does the panel think about this kind of approach?
Perhaps I'll kick off. I think a lot of Australian research is targeted all over the world, not just to the major market of the US and Europe. And I think that we have seen a lot of engagement with Asia in particular, and I'm thinking of some of the work that's happening right now with Indonesia, where I think that there are opportunities for Australian researchers and developers to actually have those conversations for those other markets. And certainly if you're wanting connections to some of those people here in Australia that are doing some of that work, we can certainly facilitate that through ATSE or through MTP Connect.
Anyone else want to jump in on that one? Well, then I'll wrap up with a final question to the panel. And this is in our last 5 minutes. Just would like to hear from each of you just one question about what the key steps are that the government needs to take to support health through technology coming out of the current crisis. Just a quick answer from each of you, please, if you might. And Carrie, I'll start with you, please.
Well, I think probably the main thing is that there's a lot of pent-up demand that, because people haven't been going to their doctors, haven't been getting diagnosed, there's going to be pent-up demand. And I think that it's going to be important to encourage them to extend the telemedicine reimbursements and perhaps take it a step further, because at the moment I think it's only bulk billed, so that it's going to be part of our system for the future.
Thank you, Carrie. Simon, what are your thoughts on the key ways that the government can support health technology through the current crisis?
So we've seen that government investment in patient services has made a substantial change to the way we actually translate technology into the clinic. As Carrie said, the most recent great example is having an item number for telehealth. All of a sudden, telehealth is actually becoming used and useful. And I would predict a major emphasis on increasing our technological basis for telehealth were this to continue after the pandemic. And we see it also in genomics, for example, in precision medicine, where all of a sudden we've got prescriber numbers and item numbers for various different processes that are required for precision medicine. It means it's getting taken up more, and it means that there's more research and development, and there's more translatable research that's actually happening in those areas. So the government doing this actually very strongly encourages development in these areas.
Thank you very much. Alan?
I'd like to see the government recognise that, like climate change, this is not a 3-year job or a 4-year job or a 5-year job. This is a 20-year job to get done, and we ought to stay on a track where we actually deliver on the opportunity. And that's the only way we're going to make these things happen. If you actually cut it and dice it into small parcels, it won't work very well. And the COVID the pandemic has actually brought a lot of us together, not only in this country, but it's actually connected science and medicine, globally again, because it's a global problem. And if we actually work together to solve these problems, and to develop a better medicine, not only for Australia, but the whole world, we'll all benefit. And I think we've got such a strong technology base here that we need to utilise it, and we need to get government to understand that this, like climate change, is a track which is probably a 20, 25-year track, and get on it, and stay on it, and deliver it.
Thanks, Alan. Greg, over to you.
One of the issues, as I see it, is the whole question of health education. I think we've seen during this COVID virus exercise that because of our multi-ethnic and multi-language community that we've been building in Australia, quite a considerable portion of that is unable to really engage effectively with the information that's coming out from government. And we see these outbreaks of the virus occurring because people don't understand what they're required to do and the way in which they can alleviate it. And it seems to me that we have already a lot of technology that we're not using very effectively. I know we need better technology coming along, but it does seem to me that we are not using it, and we have inequality in Australia which needs to be addressed, and certainly health education, I think, is part of that. And it's no use developing all this very smart technology if the people can't use it effectively. We have a better educated demographic coming through with the millennials, for example, and the others, but the people who are now in their middle age and aging, and particularly from overseas, who have real problems with the ethics of technology and its application, that we need to improve that education for that sector of our demographics, and particularly also for our Indigenous population. And we can do a lot better, I believe, even with what we've got. But we do need better technology, but with what we've got, if we use it more effectively in education, I think we'd see a great benefit to Australia. And I'm sure that's happening in other countries too, where there's a lack of equality across the population.
Thank you very much, Greg. George, in your estimation, what does the government need to do now to support health through technology coming out of the current crisis?
Well, I think what I would say is don't waste the crisis. I've seen some amazing green shoots and people adapting to the challenges. In oncology, we've worked out we can do our clinical trials by utilising centres close to people's home instead of dragging them into the city. Alfred Hospital has a great initiative in terms of hospital in the home, providing people with thermometers and oximeters, and they can look after themselves when they're COVID positive. There are a lot of very creative developments that are coming out of this crisis, and I'd like to see a fund that actually builds on these things that have spontaneously happened so that we don't just lose them and snap back to where we were before the crisis.
Mm-hmm.
Thank you very much. Sue, finally, what are your thoughts on that question of what the government can do now to support health through technology?
So I think firstly we should acknowledge what government has already done, and I think they've listened to experts, and we have had Brendan Murphy and all of the teams around the country that have worked so hard to provide that expertise, and government has listened to that expertise. And so I would be advocating firstly that they continue to listen to the experts. The second thing I would say is government is about the fourth biggest economy in Australia, and if they were the exemplar of digital, imagine how quickly they could drive a change to a digital economy and create new jobs and new industries. And so I think there's an opportunity to look at the broader infrastructure and digital regulatory and investment frameworks to really drive change in Australia to maximise healthcare for all.
Thank you very much, Sue, and thank you, everyone. Now, to close today's session, I'd like to introduce the second co-chair of the steering committee that's overseeing our Future Technologies report series. With a career in the senior public service and as a Prime Ministerial Chief of Staff, Drew Clark has also led Australia's broadband and digital economy initiatives. So please welcome Drew.
Thanks, Kylie. Look, it falls to me just to make a few remarks to wrap up the webinar today. Firstly, I'd like to thank the 80 plus Australian and international friends and fellows that have joined us over the last hour and a half. We're really appreciative of your interest in our work. Particularly like to thank the expert working group panellists, particularly presenter Sue McLeeman, my co-chair Catherine Fagg and the team at ATSE. Kylie, great job facilitating, and a shout out to Alex Ziebel that led the policy team that did the work behind the expert working group. The insightful questions from all of the participants were really very helpful. George stole my thunder. I was thinking of how do I wrap it up, and those two aphorisms of public policy, that on the one hand, policy is a long game, but on the other hand, never waste a good crisis. And I think the report that we've been discussing today shows both of those characteristics of good public policy. For those that have, for whom this is your first exposure to this report, I'd encourage you to perhaps read or reread the report in depth, informed by today's discussion. One of the interesting areas in the report that hasn't been discussed today is the identification of research priorities that would support the policy initiatives that we have discussed, and I commend that part of the report to you. As Kylie said at the beginning, this health report is just one part of a 3-year ATSE project funded by the ARC, looking at Australia's technology readiness writ large. We started with transport. That report is available on the ATSE website. We've now talking about health, and we're well into our third sector, which is waste and resource recovery, for later this year. And at the end of those 3 sectoral examinations, ATSE will be pulling together an overarching report on Australia's technology readiness. We look forward to further engagement with our friends and fellows over those additional reports. So that's it. Thank you very much for joining us. We'll let you zoom off to the rest of your day now. Cheers.